The goal of this lesson is to provide a high-level overview of XR technologies and then dive into their usage in medicine and medical training. It will show existing technologies that are in development and show the challenges faced by XR in the current market. So what is extended reality? The first thing to note is that extended reality isn't a technology. It's a bucket of other technologies comprising mainly of virtual reality VR, augmented reality AR, and mixed reality MR. The technologies that fall into the XR bucket have certain characteristics. 1. XR is usually used to immerse the participant into a different reality, that is reality replacement, or augment their current reality, that is reality addition. 2. XR is generally achieved through a wearable or an external device. What is augmented reality? In simple terms, augmented reality is an addition to the viewer's current reality. So AR adds to the viewer's current reality either through an indirect medium, such as mobile phones in Pokemon Go, or through a direct medium, holograms. The latter feels more natural and is termed as holographic augmented reality. What is virtual reality? Virtual reality is a form of reality replacement that allows the viewer to step into a completely different world. This is usually achieved through wearable headsets such as the Oculus Rift, HTC Vive, or the Microsoft HoloLens. Unlike augmented reality, the real world is not included in the VR worldview unless the application specifically demands it. VR has seen usage in a variety of fields and products, with the most common being video games. VR is also being used in medicine to treat mental illnesses and in medical training. Mixed reality is the overlay of computer-generated content onto the real world. This begs the question, what is the difference between MR and AR? Although similar, their difference is quite subtle and cannot be overlooked. AR deals with a very superficial augmentation of the viewer's reality. For example, an object in AR will try to stand on top of a table in real life, but that's about all it can do. However, an object in MR will not only try to stand on top of the table, but also jump around and move about in its virtual environment while avoiding other objects in this physical space that is captured into the virtual environment. This gives a more natural feeling to the virtual object, making it seem more real. Apart from video games and medicine, XR is used in various other fields. Immersive entertainment. AR, VR, and MR allow for viewers to immerse themselves into their favorite band concerts, exhibitions, and events. A very common form of immersive reality is the virtual walkthroughs of various college campuses through a browser or a VR headset. Training personnel. XR is used to train personnel in standard operating procedures and equipment usages. This helps prevent workplace accidents and improves efficiency through training the workers. Real estate. XR is also used to provide walkarounds for real estate buyers from the comfort of their homes. Just like any other technology, XR has its own risks. Sickness. It's very common to become sick or nauseated by using VR that involves a lot of movement. It's primarily caused due to the lack of information from your other senses in your immersive environment. The fact that it requires you to move around in the physical environment also creates a problem, since you require a space that is large and free of other objects. A person using VR in a cluttered space like their home, for example, is at a disadvantage here. Costs. The development of an XR application costs a lot of money and time. The hardware costs a lot as well. Complexity. Since XR is ultimately trying to replace reality, or at least inhabit it, its complexity goes up by a lot. Every application requires a specific set of programs to be developed, which requires a lot of technical expertise. This reduces its overall development speed. Now that we have a brief overview of what XR is, let's move on to how XR can be used in the field of medicine. Before we go into the usage, we need to understand how the field of medicine could use XR. Medicine and technology have been synonymous for a long time now. To be clear, technology here is a mechanical or electrical device that helps augment medicine and make life easier, quite literally. From thermometers, microscopes, to electrostatic machines and X-rays, medicine has benefited through technological ascendancy immensely. The most impactful growth would be when medicine met computers. The advent of computers in medicine meant several things. 1. Ease of labor. Computers could be used to constantly monitor patients during hospice or surgeries, thereby reducing the load of medical staff, leaving them to pursue other important tasks. 2. Accuracy. The temperature taken by a digital thermometer or the EKG chart generated by an EKG machine is more accurate compared to a manual temperature check or a stethoscope check for arrhythmia. Computers allowed for more precision in medicine and help save time and lives. 3. Rise of specialists. Computers help specialist jobs such as ophthalmologists and radiologists to do their jobs better. 4. Record storage. Patient history and record maintenance is very important in medicine. Knowing a patient's illnesses and being able to cross-reference it with previous diagnoses helps a lot. Computers make this easier with the digitization of these records. Such digitization also reduces costs, since no longer do people need to physically store and retrieve those records. So where does XR fit into all of this? Honestly, everywhere and then some. The possibilities are limited by the imagination after all. AccuVein. AccuVein is an AR technology that superimposes heat signatures of a patient's veins onto their skins, making it easier to find veins. Finding veins, be it to inject, insert a drip, infuse, among other things, is one of the primary things that a healthcare staff would normally need to do. Even though personnel are trained to locate veins and pierce them efficiently, it's not as cut and dry always. The location and visibility of a vein depends on several factors such as skin color, blood pressure, diet, etc. Sometimes veins roll around the needle if the patient hasn't had breakfast, which makes it necessary to switch the needle to a different location. Tools that improve the quality of life greatly reduce the time spent on elementary tasks such as these. Karuna VR. Karuna VR is a VR technology that helps treat chronic pain and motor skill issues. It retrains the patient's brain into thinking that the movements that were painful before are okay to do so now. It aims to fool the brain into thinking that the physical movement trained as painful earlier is safe to do so now. Virtual reality exposure therapy. Virtual reality exposure therapy, such as BraveMind, Limbix, etc., is a form of exposure therapy where the patient is repeatedly exposed to their source of trauma in a safe environment. In this evidence-based therapy, the patient is made to relive their fears under supervision and in supervised amounts in order to help them re-evaluate their response to it. Over time, the patient becomes used to it and thereby reduces their intensity of response, to put it loosely. This is extremely helpful to especially combat veterans suffering from PTSD, but also any person needing mental health care. There's a lot of work being done into more specific and complicated fields with XR, such as treating Alzheimer's. A UCLA scientist, Nanthia Suthana, is trying to study the human brain to try and use VR to prevent memory decay in the form of Alzheimer's. The idea is to use brain implants and find out how the human brain creates memories. The goal is to understand the process and recreate it in VR, so that people with memory loss can view, relive, and hopefully remember them. Surgery planning. VR is being used in surgery planning by doctors and hospitals in various places. It helps doctors practice for an upcoming surgery, thereby reducing risks. Treating Parkinson's. VR is also being used to treat Parkinson's in patients. The disease affects the patient's walk, among other motor skills, which is debilitating. VR training has proven to improve the motor skills of said patients. Unfortunately, problems with VR sickness has caused this technology to be not used for mainstream treatments, and therefore it requires further testing. Training is extremely important in medicine. In order to achieve any position within the field of medicine, it requires years of practice. Lack of training and discipline often leads to negligence, which may cause harm to a patient and in some cases, even death. Negligence is one of the leading causes of death in patients in the United States. Therefore, it becomes more important that medical practitioners be properly trained before deploying them on field. However, this is not an easy task. There are several issues that hamper medical training to be done in a timely fashion. 1. Logistics and time. Medicine is not an easy thing to study. One cannot pick up a For Dummies book and learn it. It requires a lot of time to be invested and resources to be allocated. Trainees need a trainer who needs to be an already established health professional, equipment, and location to train. Once allocated, these resources are tied up until the required time period, which has the potential to create a deficit somewhere else. 2. Costs. Medicine isn't cheap. It can cost upwards of $200,000 to complete the required years of undergraduate study, before going into the desired fields of study. So, XR provides some things that a physical classroom or training curriculum cannot provide in the form of remote assisted learning through computers. Both in education and practical training, the value of remote education is unsurpassed. Students and professionals no longer need to travel to a different location to learn or practice their craft. They can do it at the comfort of their current location with ease. Mixed reality is being tested in medical education where students are being taught subjects such as radiology, surgery, EMS training, among many others. Through guided imagery and real-time interaction with their instructors, students can make the best out of their time to learn with minimal risk to any patients. Medical personnel can train themselves in several medical fields such as gynecological procedures, laparoscopy training, open surgery training, triaging, etc. A very good example of this is the Stanford Virtual Heart Program, where students are invited to learn about heart defects and how surgeons use specific procedures to correct these defects with the help of VR headsets. With high-quality imaging and a 3D anatomical model to observe, it becomes easier for students to understand what is happening beneath the tissues that they're trying to save. A researcher at the Imperial College of London uses the Microsoft HoloLens to analyze patient conditions and collaborate with other researchers through the same medium. Fundamental VR is developing an application that allows MR to be combined with the HoloLens to allow for a seamless teaching experience. Also, VR is trying to help surgeons do their craft better. It also endeavors to teach new technologies such as robotics and implants, which require careful precision and patience to implement. XR still has a ways to go. The cost of development, use of wearables, risk of hardware or software glitches make it a poor match for medicine currently. However, the field itself is very new, and the development being done over these few years have been promising, to say the least. XR technologies are already being talked into possible usage to help with the current global pandemic as a form of counseling and stress relief. Further usage and development will only enhance its capabilities and hopefully be able to eliminate one or more of its shortcomings. This will make it very feasible to use in medicine and training those who practice medicine in the near future.